Representative Heverin.
Here.
Representative Moser. Chair Bentley.
Here. There are a lot of people in other committees taking votes right now, so they'll be in and out. So look for them as they come in and out on the roll call. We have one item on the agenda this morning. We have representatives from the Office of the Attorney General, Mr. Will Schroeder and Mr. Chris Evans, who will be providing an update on the Kentucky Opioid Abatement Advisory Commission. Members, hold your questions till after the presentation, please. Presenters, the little green light has to be on for us to hear you, and please identify yourselves for the record before you speak. At that, welcome to our committee.
Thank you, Mr. Chair, for having us. Will Schroeder, Senior Counsel for the Attorney General's Office. It's good to be before the committee.
Thank you, sir. Chris Evans, Executive Director of the Kentucky Opioid Abatement Commission. Thank you.
Thank you, Mr. Chair. I think I would like to begin just by having our director give a little bit about his background and share why he was such a good fit for this role.
Thank you. And first of all, I'd like to say thank you very much for the opportunity to be here with you today. I understand the importance of the work that you do, and the ability to have the time with you is much appreciated, so we can enlighten you and give you a little background. I have been asked to give a little bit of my background in terms of the relevance to the commission and to the role that I play. As what was said before, I'm a 29-year veteran of the Drug Enforcement Administration. I've served through numerous offices throughout the country. What's relevant to this position is in 2017, the DEA brought me to Kentucky with the goal of starting a new regional office for the Drug Enforcement Administration. Excuse me, the first time it had been done in 20 years. And in a 90-day time frame, it took the Louisville office from a local office to the regional office for Kentucky, West Virginia, and Tennessee. After doing that for 2 years, I was asked to come back to Washington, D.C. and be the Chief of Operations for the Drug Enforcement Administration. And what that role entails is oversight for all of DEA's domestic offices, which is approximately 290 offices, as well as 90 offices in 68 foreign countries. So that was my portfolio for that point in time. The other relevant position I held back in D.C. was during the transition from the Trump administration to the Biden administration. I was asked to run the agency during that transition. So for 6 months, I ran all the operations for DEA, from the regulatory side as well as the operations to prevention, treatment. Every aspect of DEA came into my portfolio for those 6 months. So that's what leads back into the history of those things. Two other roles which I filled, which are relevant to this, were that I served on President Trump's Commission on Law Enforcement Administration of Justice with other law enforcement experts, and the subcommittee I sat on dealt with law enforcement and social issues and the intersection of those two. And then I was also asked to participate and be a member of the Commission on Combating Synthetic Opioids, which was part of the Defense Authorization Act and was staffed and led by U.S. Senate and House members, as well as leads from all relevant departments and department heads within the Department of Defense, Justice, as well as some of the social agencies in the administration. So that was that aspect of it. Now, that covers a lot of things, and when people hear DEA, they expect a lot of the law enforcement aspects of it. But what I also try to make sure people have clarity on is the overview in terms of what reaches to this. And the relevant piece of that is an example of the prevention piece. And as the special agent in charge of the Louisville office, we brought the Mark Wahlberg Foundation here in 2019 to conduct a opioid awareness event for youth. And we had over 8,000 students from JPCS in one venue being able to get exposed to ways to help themselves, to protect themselves in a manner that they were able to receive it with their peers and with others going through. So that is a viewpoint I take in terms of what it looks like moving forward with prevention and being able to go through and engage. I really view this opportunity with the Commission as a generational opportunity. I believe that we have the opportunity to help save lives, and quite honestly, that is my mission, is to make sure we look forward and move forward in saving lives. So that's some of the background on my activities.
Thank you. And I know, obviously, we heard the experience, we heard the passion there, and I know from talking with the director, even in his time in D.C., he maintained the residence in Kentucky because that was important to his family and calls Kentucky home. So it's good. Director, if you would explain to us, just give us a little update on the commission. I guess we're going into the second month of office here for Attorney General Russell Coleman, and where are we at? What does it look like currently?
Thank you. Yes, and so where we're at this point in time is this is about 1 month into my tenure. So as you understand, that's also background for you and relevancy. We've had one meeting. The first was the first week on, which went through where we currently stand with the commission, what things look like, and the ability to move forward. The grant application process was open on January 1st for new applications. That will close on March 31st. So we will have our next scheduled board meeting or full meeting of the commission will be next week. What will also meet is the subcommittees. What will take place is that the subcommittees will also continue to align and direct and identify the appropriate times to move forward on advancing those applications. We know that there are a number of approximately 90 applications which are in the queue. That does not mean that they're all included, that they're all completed, but we know that those are in process, so we're going to have to move forward with that. We want to make sure that we take fresh eyes and a fresh look at the work of the commission. We want to make sure that everything we're doing is in the best practices and the best ways to advance the needs of the Commonwealth. We also want to make sure that all the work we do is collaborative. We want to make sure we engage with all parties and make sure we want to hear from all parties. Again, that includes what you might have for us today to be able to hear. But we want to make sure we keep our eyes open, we listen with our ears to make sure we can get all the input. And again, the goal is to take that information and to be able to build and help programs build and sustain that advance the needs of the Commonwealth. And that's really the way that we're looking forward, is trying to make sure that we can take in all the information we can to make things better and consistently improve and consistently try to improve the health and the well-being of the people in the Commonwealth. So with that, if there's any other questions.
Yeah, Mr. Chair, at this point, we'd really open it up to the committee and see what information we could provide committee members with.
Thank you, Senior Counsel Schroeder. I got that right for a change, didn't I? I was going to call you Senator Schroeder again.
Thank you.
I'm sure that our new executive director knows the difference between opiate and opioid then. You're well qualified with your resume there. Thank you for serving Kentucky. And thank you for your presentation. Are there any questions from the members? Well, I got some questions. Do you have any good reports back from any of the money that's been distributed?
Yeah, the short answer is yes. I think one of the things that we've started to see, and part of the program and part of the things that we expect to do, is the outreach and being able to actually engage and do on-site visits with these programs. We've just had the first one this week, and without going into who it is or putting them on that spot, I think there will be real opportunities to see where that money is being spent and making progress towards the people of the Commonwealth. Again, we're 1 month in, so we haven't had a great opportunity to really get out there and see all these things yet, but that is part of the plans in terms of looking at the best practices of being able to get out, identify those things, and see where we've been successful, but also see where we've been challenged, and in those areas look to identify how we can be better.
I have followed SB 90, and SB 90 is the pilot program, and they received their funding from the commission, around $10 million. The data coming back from that is done by the Fletcher Group, and it is excellent. I mean, that intervention before they get in front of a judge, and then they're first-time offenders, and then they're educated. Have y'all looked at it, members? Look, it's really a good program, and that's no taxpayer money. It's coming out of the commission. And I suggest everybody look at that. It's such a good pilot program. 11 counties, and I hope that more counties will apply through the portal for that, because the data is excellent. It is, I mean, it just, and no taxpayer dollars are involved with it, and it's really working for the Commonwealth. So you said the portal will close March
31st at the end of the month. of March.
31st. And you've had how many applications so far?
Well, at this point in the portal, I've been told that there's over 90, but that does not mean that everybody will complete all of those applications. So again, we're waiting to see where that looks like.
Okay. Anybody have a question? Representative Wilner? Representative Roberts?
Director, thank you. It's a pleasure to meet you. Congratulations on the new post, and thank you for serving Kentucky. In your introduction and your history about yourself, you talked a lot about your history with prevention and law enforcement. Is there anything in your background that you could tell us about on the treatment side, or maybe some of your vision for helping to use these funds to assist those in active addiction in the state of Kentucky?
Thank you for the question. I appreciate that. That has been part of it. The pillar which we really operated under, and work I've done that and work I've done outside of government afterwards, really relies on the three legs of the stool, as people talk about: prevention, treatment, and supply reduction. And all aspects of that are important on all those pieces of it. I have had work and contacts with individuals specifically about those items. I think that is a critical piece of what is needed and what's done. Again, that three-legged stool, which is often referred to, is so important, and that part of it is a significant part of it. I know there are people who have asked about different aspects and where you lean in on and which one is more important. And my response is always, they're all important, and you have to make sure that you focus on all of them. You have to treat all of them. We need to make sure that we reach everywhere that we can reach and every population that we can reach, because we don't want to leave any family behind, and any opportunity to save a life or help a family is one we need to take.
I do. I'll follow up on Representative Roberts' question. The grant applications that are coming in, are they geared toward prevention, treatment, and supply reduction sort of in equal measure, or are the grants targeting, I guess, what is the grant for?
Right. So the grants will typically fall into those two categories: a broad category of prevention or treatment recovery. I don't have for you the numbers of what it looks like for the ones currently in the portal, because also, as I've said, those are not completed from the vast majority of those. Many of our people have just opened up and they've started the process, but they haven't completed it. So we won't know until later on in terms of what it looks like, whether there is a skew towards prevention or a skew towards treatment. I will tell you, in the past, there has been much more geared towards the treatment recovery than there have been towards the prevention grant request.
Any other members? Your meetings are open to the public, correct?
Correct.
And you're still meeting on, what do they call that road over there? What's the address over there?
The East Campus.
The East Campus, yeah, because a lot of people don't realize that. And I had another thing I was going to say. Oh, full disclosure, I'm a member of the commission. So if you need someone in the house to talk to, come to me and I'll take it to the commission. Okay, no other questions. We want to thank you, Executive Director and Council Schroeder. It's hard to get these new terms to people in this first 30 days.
Mr. Chairman, could I ask a quick
Sure,
follow-up question?
sure.
Thank
Yes,
you.
ma'am.
Thank you very much, since we've got you. And I hear over and over again more focus on treatment than prevention, not just from the two of you at the table, but prevention is obviously better, right? If we can keep people from being involved or, getting addicted in the first place. What have you seen, either of you, but what have you seen from prevention efforts that are effective, like on a community-wide basis?
Sure. Thank you. I think what's critically important is that engagement and utilizing those tools which are evidence-based. I don't want to go through and say here's one that's particularly suited better than other. I think one clearly is the engagement. The earlier the engagement is, the better off it is. Looking and trying to identify those that have evidence-based solutions in terms of the ability to show that they have worked before is one of the tools and things that people want to be aware of and we want to look at. But I think, again, the current process is where we need to identify everything we can and keep an open view in terms of what those things look like.
And I'll just add, as we're going through and looking at what has been successful in the past, I mean, unfortunately for our country, but fortunately for the program, we have other states who are much in similar boats going through this process as well, and we're starting to see articles and studies and reports from different states and the impacts that different programs are having in those states. So we're not just looking at Kentucky, but beyond and seeing what's successful in the other states, and looking at how that could be implemented in Kentucky.
No other questions? No, the next item is adjournment. Do I have a motion? Have a motion and a second?